presentation. And thanks to UConn Tab for Region 1 for allowing me to present today. My name is Miles Ballog. I'm a National Brownfield Practice Leader for InSafe, and I've been a Brownfield practitioner for nearly 30 years, and also I'm an environmental justice, equitable development, and health equity advocate for that same amount of time. And so today I want to share with you a little bit about the concept, the brownfield to health field concept, and then give you a few case studies. So hopefully you can take those back to your community or communities you work with and implement a reuse strategy, which I think is very beneficial. And I think if we don't have a health field component in many of our brownfield redevelopment projects, we're kind of falling short. And so let me just jump right into it. All right. So a health field is really using brownfield principles, grants, resources to improve access to health and healthcare within underserved communities. The primary goal is really to reduce health disparities within low-income and minority communities through brownfield redevelopment. And in my view, and you'll see through the case studies, it's really a critical element of environmental justice through brownfield redevelopment and also equitable development. I have a good friend, Susie Rule, who's with the Yale School of Medicine, and we go back almost 30 years working on brownfield to health field projects. And she's a little bit more eloquent than I am. And she says that B to H, or brownfields to health field, implements a triple bottom line justice. In other words, we're tackling environmental challenges. We're also tackling health disparity issues. And many times we're improving the local economy. And I'll get into that more. But the reasons why do we do health fields? If you look at a GIS map, I used to show one of Health Zone 1 in Jacksonville, Florida. You'll see literally hundreds of brownfield sites, Superfund sites, other regulatory listed sites. Within that Health Zone 1, there's higher levels of health disparities than anywhere else within that county. And the city of Jacksonville is also the entire county. So in many areas that are low income minority, they're impacted by brownfields. We see this correlation between that and health disparities. And also in many of those communities, there's a lack of basic health care and other services in environmentally overburdened communities of color. And B to H is a way to help move that disparity forward as well. And then there's other negative stressors within communities. And I know that the National Environmental Justice Advisory Council is working on cumulative impacts pertaining to EJ. And this is another way to lessen some of those cumulative impacts. But the main focus is to remove health disparities, and with brownfields redevelopment, and particularly with the grant funding that's increased for cleanup grants up to $5 million, we really have an opportunity to remove contamination from communities and also address the social determinants of health, including housing, food, nutrition, and access to care. You'll see the image on the right of the slide, and that basically is talking about if you live in a less affluent community, your life expectancy many times is shorter. And to me, that's a travesty. And that's studies have been done across the country that show, if you live in a poor community, many times your life expectancy is less. I think that by dealing with health disparities through brownfield redevelopment, we can address that and start moving in the right direction. And when we talk about brownfields to health fields, although many of the case studies I'll talk about today are healthcare related, that we don't stop there. It's basically anything that can reduce health disparities. For example, open space and green space can address obesity, diabetes, and other diseases. Access to healthy food choices, the same. improving access to grocery, community gardens, farmer markets, and healthy food choices, healthy homes, particularly if you live in an area that has poor housing stock that has impacts from, excuse me, asbestos and lead-based paint and indoor air quality. And then we also have, excuse me, the opportunity to improve health in the built environment. In any brownfield project, there's some cornerstones, but particularly in Brownfield to Healthfield, and we're really focused on community engagement and involvement from the very beginning of the project, shaping the project, all the way through delivering on the community's vision. It's really critical to have the community at the table, to understand what the vision is from the neighborhood, to understand, particularly on a health related basis, what the health impacts are. And if the community is not at the table, they say they're on the menu. And so, in other words, you don't want to have a brownfield project where you bring it to the community right before approval. Really, I believe in community led and driven brownfield redevelopment projects. This is also a way to ensure equitable development, that our brownfield projects don't result in displacement and gentrification, and more importantly, that there's direct community benefit. So, if you live in a brownfield area, they have a brownfield grant, and you're doing these projects, what is the benefit to the community when they walk out the door? And then I've thought for years and years that the brownfield program is really a key tool to implement environmental justice, predominantly through removing contamination and also through risk communication and redevelopment, getting those end uses out of the community that are not good for the community and replacing them with end uses that will improve health. But at the end of the day, a successful brownfield project can generate a lot of revenue. It can definitely increase the tax base. It can do a lot of positive things for local governments and the community. But really, what our true measure of brownfield success is, are you helping to realize the community's vision? So the redevelopment process, we're currently working with City of New Bedford and the Old Bedford Community Development Agency or corporation, and we are implementing a new brownfield process, which starts with comprehensive community engagement from the very beginning, looking at doing a brownfield health impact assessment, not only for what the negative impacts might be from brownfield sites, but more importantly, or as importantly, what are the positive impacts of redeveloping that site in a brownfield to healthfield approach. Also, extensive environmental assessment and risk communication is important so that the community understands what the technical issues are. And then we flow from the health impact assessment into the reuse planning, looking at what the reuses could be with the community and going through a process of selecting the correct end uses, and then doing a resource roadmap to bring those resources together so that the project can be real. It takes a lot of partnerships. It takes a lot of patience. It definitely takes a lot of community engagement, but we're really looking at community-led equitable redevelopment. And, the results of this is removing contamination from communities, addressing health impacts, economic development, and once again, realizing the community's vision. So a few case studies. I'm sitting in Clearwater, Florida, and I started my brownfield career there, and going back many, many years, almost 30 years, my first health field project, before we called it Health Fields, was the Willa Carson Health Resource Center. Miss Carson was a retired nurse, and when she retired, people would knock on her door all the time wanting to get health care. So she moved her healthcare services after she retired from her home to the Greenwood Apartments, and across the street from the Greenwood Apartments was a old gas station site. And she formed the partnerships with the community the city, state legislature to get money to do the environmental cleanup of the site, and then tobacco settlement money to actually build a free clinic, which is still in existence today. So in my view, Miss Carson was the original health field pioneer. We just put a name to it. Here's another site in the middle of Florida, and this is in Mulberry, Florida, in the middle of phosphate country. And in Mulberry, they hadn't had any health care in the community for over 10 years. The nearest hospital was between 10 and 12 miles away. And so the Central Florida Regional Planning Council used their Brownfield assessment grant to work with the city of Mulberry to identify a site that would be a good site for a federally qualified health center, worked with Central Florida Healthcare, which is a federally qualified health center, to bring a new health center there. The EPA assessment grant funding was used for the assessment of the site, which was next to an old gas station or an active gas station, to make sure that there weren't any impacts. Reuse planning in order to show how that the federally qualified health center could fit on the site, and then collecting additional information, which led to 2 HRSA grants that helped build this federally qualified health center. One was a school-based healthcare center grant, and the other was a new access point grant. And it also took many, many community partners. The lady who's sitting at the desk is Miss Julie. Her husband was on the commission. And she said the important part of this, having this federally qualified health center within the community, is that people could actually walk to it. And that was extremely important to her, instead of having to drive, 10 to 12 miles to get health care. Here's another site in rural Florida, Pasco County, Florida. And this was the Lacucci Community Center. The community actually worked together to raise over $1 million to build a new center. They worked with Pasco County to do the environmental assessment on the site. During the assessment, they found contamination. They also applied for a $200,000 EPA cleanup grant. They did cleanup on the site. And part of the activities through the Brownfield program was to do a health impact assessment, where we were able to have Premier Healthcare, which is another federally qualified health center, do that health assessment. And now they operate out of the center. And we talk about holistic projects. This site not only has a federally qualified health center in it, it also has a safe place for children to go with the Boys and Girls Club. It has a gymnasium for recreation. It has recreation on the outside of the facility. And really, when you're looking at Brownfield to Healthfield projects, holistic is really the way you want to go if you can fit, multiple different end uses that will impact health. And I wanted to throw in a couple non-healthcare projects just so that we know that we're not talking all about healthcare. This was the Bunting property. It was an old apartment complex that fell into disrepair. Mr. Bunting started collecting everything known to man, including hazardous waste. We were able to use state appropriations to clean this site up, and Mr. Bunting agreed to transfer the property to Clearwater Neighborhood Housing Services. So once the site was remediated under Florida Brownfield program, it's now 2 single-family homes. And moving on to another housing-related project. This is Central Park Village in Tampa, Florida, that was really run-down public housing. The Tampa Housing Authority partnered with the city of Tampa and got a neighborhood stabilization grant, along with Bank of America CDC. This site had asbestos and lead-based paint in it, also had lead in the groundwater, and they use EPA Brownfield assessment fundings to deal with the lead in the groundwater issue. The cool part about this site is that people did have to be relocated from this to do the redevelopment, but you see the building in the lower right-hand corner called the Ella. That was senior housing. A lot of the folks that used to live in this original complex came back and now live back on this site. which is the Encore redevelopment project. And then I also want to talk about other funding sources. ATSDR used to have a Brownfield grant. They don't anymore. But if you're looking to do Brownfield to health fields, you're always looking for other funding sources. And right now we have community change grants, which if you implement those, you can actually incorporate health. And then you also have things like the Grant Makers program, where community-based organizations can use those to address environmental justice and implement health. This particular grant was a $150,000 grant that the East Side Environmental Council, which was a grassroots nonprofit in Jacksonville, worked with the Duval County Health Department to do health impact assessments, and also they opened 7 community gardens on school sites, so kids could learn about raising fresh produce while they were at school in a curriculum. They also did soil surveys within the community, so if somebody was doing gardening at home, they could make sure that they weren't gardening in contaminated media. But I think it's important to look for other resources. Now, a couple other holistic projects. This is the University Area CDC near Tampa, Florida. It was a tremendous partnership. We talk about outreach and engagement. The CDC has full-time people where their job is to do outreach and engagement and get the community involved. And you see the picture at the upper left-hand corner. That's the team of people and community members that worked on this project I'm going to talk about now. And this is the Hope Harvest Center. The first thing that the CDC did was to buy an old recreation field that was located in the heart of the community. It didn't have any or many environmental impacts or any thing that required remediation, but they did use Brownfield funding to do reuse planning. They also got the kids involved in order to design a new playground through the Kaboom program, and the Tampa Bay Rays were also involved in that. But in addition to doing a playground, they also cleaned up. Let me go back. This you see the lake. That lake was full of garbage. The community actually cleaned up that lake, and they're allowed to. They have fishing now, subsistence fishing. The water quality has been tested for that. And really, the other thing that they're doing is around this Hope Harvest Park, they are developing affordable housing, because a lot of the housing stock there is really old housing stock that has issues with asbestos and lead-based paint. And I'm going to leave you with this last case study, which was an old railroad spur. This is in Palmetto, Florida. They were able to use the county's assessment grant to assess the site, which was contaminated. They were able to get a $200,000 cleanup grant to clean up the site. With some additional funding from the Water Management District, they were able to build a stormwater treatment facility, which now cleans 50 acres of water that was untreated before it runs into the Manatee River. And it also created habitat restoration, and they have a trail that runs around it for walking as well, and a gazebo. Just an example of multiple positive benefits related to clean water and clean health that you can do with the Brownfield to health field approach. So if you look at these projects and you evaluate each one of them, they have some commonalities. They all address environmental justice and equitable development. All of them had to deal with contamination and removing contamination from overburdened communities. They all help deliver on the priorities and vision for the community, and they implemented strategies to improve the overall health of the community. It's just important, really, when we're doing brownfield projects, that at the end of the day, we have projects that can address health, because many of the communities we deal with are certainly environmentally overburdened. And with that, I'll open it up for any questions. We have 10 minutes for questions if anybody has any that they'd like to bring forward. Okay. All right.
Miles,
Yes, sir.
question this is Michael. In the examples you've been giving, can you talk a little bit to how these projects actually got started? Like uh, who or what entity was in the initiator of each of these different efforts, and do you see a pattern there for how that works?
Yeah, I think in all cases it was really community driven. I mean, we talk about, well, just going back to Willa Carson. I mean, she was well respected within the community, but I remember the community meeting that we went to, and most of them can be contentious, and people are not always on the same page. But when she was talking about wanting to put a free clinic on that site, it was unanimous, and there were over 125 or 150 people in the room, and that really comes from community, something being community driven. In other cases, the actual grant recipient, like Central Florida um, Regional Planning Council, was working with all the different cities within their region and talked to the city of Mulberry about their needs. And the city started with the need for healthcare, but really the community embraced that. They developed like a working group, which was mostly community members. So I think the brownfield to healthfield approach is really, doing the work up front to figure out what the community's vision should be, and help to implement that. But a lot of times it's, if it's through the EPA grant program, it's, the project officers and the city, or the grant recipient, who's taking the initial step to let people know that this is a possibility, and then get the input from them.
Do you often see where the city or the municipality has a particular plan they're working against, a 3 or 5 year plan, something like that?
Yeah, I mean, they all have capital improvement plans, capital improvement budget. So sometimes the brownfield program can be instrumental in um, in implementing that plan, and can help with the environmental components of that. But I really think that it's more about, every brownfield grant that I've worked on, there's some type of, community involvement planning. Some people do it well, some people do what they have to do. It's really going over and above and reaching out, and also using health impact assessments to determine what the negative health impacts are to the community from brownfield sites, but more importantly, what are the positive, what's the positive potential? What can you do with that site that would improve health? So yeah, I think there's some plans. I'll give you an example. Um, Many local governments have HUD funding, and the HUD funding requires, plans with what they would do with their community development block grant funds. And many times that planning, neighborhood revitalization strategy plans, can be used as a really good basis to look at the issues that are community-based issues within a community, to improve, and to use brownfield sites. But a lot of times people just don't think about using the brownfield site. So I think it's a matter of, discovering what the possibilities are.
But thank you.
You're welcome. Jackie, you have any questions? I don't know if we're all on mute. Let me see if I'm okay. I don't know. Randy, can you